Hey everybody, I'm Dr. Wagnon, and today I want to talk to you guys about degeneration and symptoms. And most of the time when I go over x-rays with a patient or patients, I go over their x-rays and they see it, and sometimes they'll be in phase 2. So I'm gonna show you guys this model here. So we've got this model here, we've got textbook normal, phase 1, phase 2, and phase 3 of degeneration. Now, in the textbook normal, you can see these discs are all nice and thick. They're jelly filled, right? And the thicker those are, the more room that these nerves have to come out, function, flow, and heal. So as long as this joint stays healthy and moves properly, this disc will maintain its height. Discs are avascular, meaning they get most of their nutrients and get rid of their toxins from motion and movement. So as long as these joints are moving right, it's gonna stay healthy. One of the purposes of chiropractic. Now, this is phase 1. It takes 0 to 5 years to get into phase 1. Phase 1, what happens is you start to have improper alignment and therefore improper function. That is gonna cause these discs to begin to thin. There's no bone spurs or anything like that. The neural foramina, where the nerve comes out here, it's still pretty wide open. The nerve still has quite a bit of room. You can have a lot of symptoms. You can have symptoms even in textbook normal. You can have a lot of symptoms here. Phase 2 happens 15 to 20 years later, and this is where this disc continues to degenerate because of a subluxation, which is when that spine misaligns or stops functioning properly. 5 years here, 15, 20 years here. These are estimated numbers. But what happens is that disc thins out and the body will start to grow in these bone spurs in phase 2. That's where the bone spurs come into play. Now, the thinner that gets, you can see it will start to infringe or impinge upon that nerve and will affect the function of that nerve even more. And if the function does not get corrected here, it'll continue to move on to phase 3, which is where these bones actually fuse themselves together and that nerve is very interfered with, and healing and functioning will not happen very well. Now, can't correct it here. You actually can correct problems here, you can correct problems here, and obviously you can correct problems if you're still in the textbook normal phase. Now, the interesting part about this though is most people assume that the further along this line you get, the more symptoms or the more pain that you're gonna experience, and that is actually not always the case. Yes, it's more common the further you get down to have more physical ailments, but it's not always the way it happens. I have patients, and I had one yesterday come in who is in a phase 2, but he wasn't having any severe problems. He came in because his wife got great results, and he's like, well, that sounds great. I wanna go in and just keep myself healthy. He was in phase 2, not a lot of pain, anything like that, but he was having phase 2 degenerative changes happening inside his spine. So I taught him about correcting function and maintaining that and preventing it from continuing on to a phase 3 and the benefits that he would have long term with that. So that's the interesting part, and he was super excited about that, as am I, that even if you don't have symptoms, it's just like a cavity in your tooth. You can have a cavity, not have any major pain or symptoms to go along with it, but if you let it go, and it continues to move further down, that's where you most likely will have significant problems. Just like if you let that cavity go, eventually you're gonna have that root canal and you're gonna have some major issues. So I wanted to go over that with you guys today so you can understand these different phases of degeneration. Obviously, the sooner you catch something and treat it properly and really rehabilitate those joints, the better off you're going to be. 1, you'll have less degenerative changes. 2, and most importantly, you're gonna have heightened nervous system function. Your organs will work better, you'll heal better, you'll feel better, you'll have better hormone flow. Everything that has to do with your health will be improved by having a healthier spine. Look well to the spine for the source of all disease. And that is exactly what we do and why we pay such close attention to the spine. I appreciate you guys, and thank you for tuning in. And I look forward to seeing you guys on the next one. Take care.